For some women, unexpected leaks can interfere with day-to-day activities. Do you find yourself avoiding exercise or outings with friends and family, and worrying about sneezing or laughing because they could trigger a leak? If so, you're not alone. Many women isolate themselves and avoid talking about this with friends, family, or even their partners. But what you're going through is common. In fact, up to 40% of women experience this in their lifetime. Often it is a result of pregnancy and childbirth, but there are many other causes too. It's a medical condition called stress urinary incontinence, where the body involuntarily leaks urine, often brought on by movement like coughing, sneezing, laughing, or even lifting heavy objects. SUI occurs when the muscles that support the bladder, the pelvic floor, and control the release of urine weaken. Normally, these muscles help the urethra, the tube that carries urine out of your body, stay closed as the bladder expands. But when these muscles weaken, it puts pressure on your bladder, which can cause urine to leak. Even though SUI is common, many women don't seek treatment or even talk with their doctor about their symptoms. Many just suffer in silence. But you don't have to live like this, because there are a number of options to treat SUI and give you more control. Talk to your doctor to understand the different treatment options and what might work for you. Urogynecological mesh is one treatment option for SUI. In this procedure, a flexible strip of plastic mesh material is placed in the body. The mesh is made from a material called polypropylene, and these products are reviewed by the FDA. Polypropylene has been used in medical procedures for more than 50 years. It is often used for hernia, tendon repair, sutures, and wound closure. Mid-urethral slings are considered the standard of care for SUI. They are supported by leading medical societies and often performed by a urologist or gynecologist. During surgery, your doctor will insert the mesh strip, known as a mid-urethral sling, under your urethra through a small incision or incisions. This sling acts like a hammock to restore the natural support to the urethra, which helps reduce the involuntary loss of urine. There are multiple ways to insert the mid-urethral sling, and your doctor will work closely with you to determine which option is best. Complications with this surgery can include discomfort, pain, or difficulty urinating. Your doctor can further explain all of the potential complications and specific risks based on your medical history and the approach used in your procedure. Talk to your doctor about recovery, but women typically return to normal activities after 6 weeks. Any medical treatment has risks and benefits. The decision to treat a medical condition with an implantable device is a serious one and should always be made as part of a discussion between you and your doctor. Give them a call today, because you, and so many women like you, don't have to suffer in silence.